is. I mean, it doesn't mean that you could do everything and kids aren't going to experiment, but certainly just having the communication and talking about risk behavior is really, really important. It amazes me the number of parents that want their kids to go to the best college, to have a safe car, will talk to them about wearing their seatbelt, and they don't talk to them about the other stuff. It doesn't make logical sense to me. It's a great way to build a great relationship with your kids, too. Okay.
Hi, good afternoon. I'm Steve Geezer. I work at the New College Institute.
Okay.
I serve on a task force that's dealing with several different health issues in the community, one of them which is drug use and abuse.
Okay. And tell me about New College.
New College is a state-supported agency that partners with state and private institutions in Virginia to offer the third year bachelor.
Okay, okay.
So we operate very much like higher ed center.
Okay.
Like here.
Okay, in Roanoke. Okay, okay.
Difference being we have faculty members.
Okay, cool. Okay. And so you see this social piece with those students.
Well, with our
right.
Sure. Yes.
Right. Okay.
My name is Becky Forrester, and I'm a Hay member.
Yeah, I got my Mac to work. I just put it in. Thank you. Yeah, thank you.
I'm a member of Hay, and I'm also the associate director of the YMCA's here.
Yay.
And I really like that you kept talking about the YMCA up there.
But would you make sure to email Cal Johnson, the executive director?
I was with Cal last week at the retreat.
So tell him that. Yeah, I just got asked to sit on the sailing board, so that's where we had to eat dinner with your family. But you got to eat dinner with your family.
We did. We did it as a community, and Hay sponsored.
At the YMCA?
Hay actually sponsored the one at the
Okay, email Cal Johnson and say, you have to guess who is down here.
I certainly will. But I'm also a parent. She's only 2, but we're willing she'll be 16 and 17 one day. And
Yep. It starts very early, especially since I can't get my head wrapped around the fact that elementary kids have cell phones. And maybe, if I had been where, I mean, I know this all changed in 2001, but I still didn't let my kids get cell phones yet. But what amazes me is the parents that have to keep up with the Joneses and think that their kid at elementary school has to have a BlackBerry or something. It doesn't make a lot of sense. So very cool. Okay, great. Okay.
I'm Kathy Whitley. I'm a nurse practitioner at the health department.
Yes, thank you.
And I run the family planning clinics and the STD clinics. So I certainly see the outcomes.
Yeah, and are you guys, and what county are you in?
We are in 3 counties.
Okay.
I actually run clinics in Martinsville, Franklin, which is Rocky Mount, and Patrick.
Okay. Of those counties, Martinsville does YRBS for data? Okay. Do they ask sex questions?
I'm not sure.
Okay. Franklin County, does Franklin County do a YRBS yet?
I don't know. I know we did the crowd survey. We've only done that once.
Okay.
We're ready to
Okay.
And we do have a rather national claim to fame. For the past 2 years, we have a teen clinic located in Martinsville High School.
I read about that in the Roanoke Times. Yes.
Dr. Green, who's next door, of course, is my boss, and he actually went before the CDC recently to give a presentation on it. So
because I will tell you that data drives dollars.
Right.
So the more data you have, it drives the dollars. There are school superintendents that are still in the state that are afraid to give YRBS and surveys because they're afraid that people will say it's the school's problem. So again, Dr. Lang is always willing to talk to other school superintendents to help them understand it's not a school problem. And data is very important because that's how you get programs, that's how you find out where are the issues, how do we fix those. So it's about being open, and I asked that question because on the YRBS we ask, were you drinking before you had sex? So, I mean, the only kids that can't be asked that because a couple of years ago, in 2008, Virginia law changed and we don't ask the sex question of 6th graders. Because at the time, that particular group thought that if you talked about it, they would do it. And I said, okay, well, all right. I mean, let's go on Google, let's go on the internet, and let's go on Facebook, and let's go on the TV, and whatever. If you thought that asking questions was going to make the kids do it, but that's my personal opinion.
I'm Susan Canode. I'm a member of the Hay Coalition here in Lawrenceville, and I'm one of the co-chairman. I don't even know what my title is, but I do whatever they tell me.
Okay.
And I'm also here representing 4-H.
Okay.
I work with the 4-H team club and go out into the schools and volunteer.
Great organization to, again, be collaborative.
And we're also received a $50,000 grant for Health Rocks.
Okay.
And we're pushing that initiative throughout the state.
And this is why when I even present at elementary schools, I actually start with the data that talks about technology before I talk about anything else, especially with elementary school parents, for them to understand that even that, in my brain and what I've learned, is that even that technology is a health issue when we use it too much. So that's another piece of education, I think, for adults.
My name is Alexis Lee. I'm not with an agency, but I'm a concerned citizen, especially among the faith-based community.
Okay.
There's a lot of unawareness among the faith-based membership. Now, I know about the African-American churches, and there is a lot of unawareness.
Or if there's other unawareness, would it also be denial?
It probably is denial.
right. Which looks maybe sometimes, right.
Now I'm talking about the adults.
Right. Oh yeah.
We're not aware that it is denial.
Correct.
And also,
yeah,
I understand.
That makes sense.
Yeah.
That makes sense.
And I was also aware of what actually can be done. And in your presentation, I heard a lot of things that were being done. That's why I'm.
Yep. And where do you live? Are you in an area where there is a coalition?
I'm not aware of a coalition.
Okay.
I tell you, I haven't heard of one.
Okay. What county are you in?
I'm in Henry County, but I'm city of Martinsville.
Okay.
Oh,
So she can join your council.
Yes,
okay.
she can.
Part of a drug-free community support grant has to have a coalition that's been in operation for at least 6 months and have at least 12 sectors. Faith-based is a sector that they must have. I happen to be lucky that my associate pastor is on our council, and he actually is Pastor Elijah Mitwanti, and he's from Zambia, so he totally got community coalitions, and it's just very interesting to see his perspective from Africa and now in the United States and what what goes on. But faith-based is another, and they also have this at a national level. There's tons of information. If you go to our national training organization, it's called CADCA. It's CADCA, and if you just Google that, it's Community Anti-Drug Coalitions of America, and they have a whole piece on faith-based issues and how to get involved. They also have a lot of free workshops that are webinars that you can just go on and download and listen to. So, yeah, but I would definitely get involved with Hay.
My name is Dr. Kimberly Matchett. I am actually owner of OBGYN facility here in Lawrence.
Okay.
Katie actually stopped me and said, you should come. We had a conversation for like 30 minutes.
Cool.
Okay, come.
Wow.
Because unfortunately, they ended in my office.
Yeah, yeah. And again, there's just so much data that you can get connected to the risk behavior and are they using substances and getting pregnant.
But the other thing I was thinking about is that I actually have a targeted population and I have a lot of parents.
Yeah.
Because I have the females who come in and they have zero clue.
Yeah.
When I started talking to because I was actually trained in adolescent health, so actually we do a SHAS, I'm pretty sure you heard of SHAS exam where you actually go over sex, alcohol, drugs, safety, that kind of issue, which it was very surprising when they said 6th graders don't get asked that, and that just to me says
2008 that stopped.
Right, well that tells me they weren't trained for adolescent care, and actually most practitioners, pediatricians, and family practitioners don't do very well with adolescents, and so it's kind of one of those things that if you don't ask about it, you never know about it. And so my thing is, I'm new in the community relatively. It's been 4 years. But But it's just one of the reasons I came was because I'm so used to having resources at my fingertip.
Right.
And the laws of Virginia are a little bit different than what I'm used to, because I was thinking when you were talking about all the things that were stopping underage drinking. Odd enough, when I was and I actually trained in DC and actually actually did med school in Philadelphia.
Okay.
And you know,
Northerner.
No, I'm from Georgia. I'm from Georgia. But it's weird because up north, anybody under 21 can't handle alcohol. They can't sell it.
Correct.
They can't.
Correct.
They can't serve it. It's
right.
very, very different.
Right.
So coming down here, it's like you walk into the food line and you got a 16-year-old scanning beer, and I'm like, I don't get this, because literally you can have a 16-year-old scan it, but if it came to beer, they had to call a manager, and like they cannot touch alcohol.
Correct.
So it's just very interesting,
it is.
You know, sending that mixed message that,
that's,
you know, hey, I need you to get a job, but just like she said, half the jobs around here that are going to employ kids under 21 are going to serve alcohol.
Right. Right.
So they can serve it, but they can't drink.
Right.
So anyway, I just found it.
Right. Well, and you know, we can share that Silences are Golden information that I talked about at 6th grade checkup. And then the other piece is this evidence-based parenting program that we have, and that starts, Guiding Good Choices starts for parents in 3rd grade. And so we're a TOT, so we can actually come and train parents to be workshop leaders in this, as well as, you know, have that program.
I'm going to have to leave him first. We just go to the ER. I do apologize.
Okay.
My name is Mary Kate Dillon. I work with 110 Oakwood Bound students out of the Patrick Henry Community College. So we work with them year-round. It's academic, but we get on a very one-on-one personal basis with them. We need to know what's going on.
And that group can come to the ADAP. We have one. We have a regional. We have a regional one. It'll be March 31st up in Roanoke. And then the statewide one is that's for middle schoolers. And high schoolers actually prepare the workshops. And then the statewide one is at Longwood University in July for high schoolers. And then there is one for college students. And I don't remember exactly the name of it, but you can go on the ABC website under education. And Regina Wissett was here today. She has that information.
And I'm a parent of 2 20-year-olds.
Yep. And that's the biggest gray area. 18 to 21 is the most difficult area to continue to, because that's where they get a lot of mixed messages.
I'm Valerie Blevins. I'm a prevention specialist with Piedmont. Also a member of PAAC, and I'm the coordinator of the Drug Task Force in Martinsville, Henry County, and we deal with adults trying to reduce drug issues in our community.
Yep, Regina Clark with Piedmont Community Services. I'm a prevention specialist here in the Martinsville City Schools, but I'm also the organizer for the brand new Fresh Coalition, which is focused on response and education to stay healthy. So we have kind of, it's like Hayes had a baby. We kind of spawned off, and we've started our own coalition in Franklin County with the idea of going for the drug-free communities funding at some point. So I'm really fortunate. I got Hay on one side, and I've got Project Cancel on the Roanoke side. So.
Yeah, and Franklin County just butts right up to Roanoke. And Patrick County does not have a DFC, right? Okay, so that's another opportunity, and you have tons of support to get that, because there's our training organization, CADGA, and there's Owen DCP, person Shannon Weatherly. She can answer questions all the way up. I can get her to come down here, do a presentation for you guys. I can maybe even get Jack Claypool to come down here. So that's just, you know, all kinds of possibilities there. And this is my wonderful, this is our first intern. This is Samara from Radford University. And she's got some interesting things that she just brings the whole college perspective. So she's been with us since August 29th. Yep. And then Christy, do you want to introduce yourself?
I'm Christy Cousins. I work with Mothers Against Drunk Driving, and I am here to assist the phenomenon in the Snow is Nancy.
Stop. Christy and I have done, how did Friday go? Because Brooks and you did another presentation.
We did, with the Virginia Association of Drivers Ed and Training Instructors. It went fine. It was pretty quick. That we did right before lunch, just like I did today. So people were like, okay, fine. Whatever you say, just let us eat.
Good. Okay, so I guess what we can do is you can tell me where, exactly what are there some pieces that you guys want answers on, or where do you see some of the points that I made? Are there questions about it? And then I am going to show you some PSAs that last year's ABC grant. Does everybody know about the ABC Community Coalition grant? You can apply for that. I don't know all the specifics. You don't have to be a DFC. You can actually apply for it as just a group, a community group. But that's another opportunity to get some money. It's very project specific. That's how we're going to be funding the RECT, that production, the Children's Theater. And then last year, we did PSAs that I think, well, Regina, you told me you saw these on WDVJ7 was our partner in that. And the students actually produced these PSAs. So I'll show you these PSAs in a minute. But are there some very specific pieces that you want to ask or discuss?
I have a comment. While Brooke was on the panel, she's a chill member of the high school. She was referring to all the places at Martinsville High School where you can get a ride. So I went over to Mr. Flynn. I said, I saw him taking notes when Brooke was talking. I said, so now you know all these places. He said, we already knew. But the problem is they do not have the staff to monitor behind the tennis wall, the baseball dugout, the woods. They don't have the staff.
Do you guys have resource officers in your schools here?
We do.
Okay.
We have at Martinsville High School.
How big is Martinsville? How many kids?
700 or 800.
Okay.
And we're looking, I'm not sure if it's been approved yet. I've been trying to keep up with the paper, haven't been able to go to city council. There are 81 doors in this school, and I think there are like 44 exit doors.
So see that, when I put up that why and why here, that begins your sort of a logic model. So you have a problem. The problem is there's these kids outside of the school, not in the school. And you've already now, and you ask why, and then you ask why here. And you've already given me really good data. There's 44 exits in the school, and how many doors? 81. So when you talk about, you know, looking at a problem, we always, if you're sitting around the table asking why and why here are really important questions, because you start to peel away that onion. And then you ask, okay, so 44 exits, 81 doors. So then you gotta get those people around the table to come together, and ground rules are we can't put our defense on. We gotta be completely open-minded and say what is our outcome want to be, and almost work backwards sometimes with the logic model, because that outcome can be we want kids in the classroom where they're supposed to be, not outside doing whatever they're doing. Do you know exactly, are they smoking pot, are they drinking, are they just out there?
I can add another element to that, trust me, because I hear all about oral sex and all kinds of things. And I can tell you all the places
that's a perfect opportunity, and it doesn't have to be a community coalition. It needs to be, okay, are we talking about the principal was taking notes? Who was it that you said were taking notes?
Mr. Flynn is assistant principal.
Okay.
Yes.
So again, that's where if the leadership is, okay, let's talk about this. And let's really, really get down to what are the root causes. Peel away the onion. And are we all going to be open, even if it means that we've got to admit that maybe there needs to be better surveillance or better, that we've got to step up as adults and do a better job. Because that's the pieces that get mixed in that have difficulty when we're trying to solve those issues. We were very lucky that this whole piece, when it happened in Hidden Valley last March, and this mom and those baseball players, the resource officer was the coach of that baseball group that got, 13 kids got charged. And, he sat there and said, we've got a problem. And he said to the parents of the baseball players, don't deny this. Do not be in denial that there's a problem. And,
Let me ask you a question about that. Were there consequences, and did they stick to what they said that they were going to do if these kids were caught doing these actions?
The athletic policy.
I think that's a problem here, is there's this, if you do this, this is your consequence. But if you've got this last name, you get a different consequence. than some other kids do, and I think that's a problem.
Well, let me tell you, in school and out of school in the courtroom. So in school, Roanoke County has a very specific athletic policy. So they were suspended automatically. You have a choice when you sign the athletic policy, substance abuse athletic policy. You either can choose to be kicked off the team for an entire year, and no discussion about anything else. Now the court thing is different, right? But these were all athletes, okay? So, or you can choose to sit on the bench for 30 days. And there is the ability for the coach to decide whether or not they're going to practice, or at least come to practice and watch practice, so that they're not sitting at home with another risk of getting in trouble. They also have to do 2 Saturday schools with a parent, which is 9 to 1. They also have to have a drug test. They also have to go and have a drug assessment. So that's all part of the consequence, okay, they have to go through. So that happened at homecoming a year ago. That happened, apparently there were some incidents at Christmas time, and then that happened especially in March. Now, on the side of, and then there were several of them that started doing community service, and I got several calls, and there were kids that went to sticker shock because these were athletes. One was teetering on losing a scholarship to the Naval Academy, okay? So there were some, but